The National Orthopedic Hospital, Igbobi, is one of Nigeria's foremost tertiary health institutions, renowned for orthopedic and trauma care. But since November 14, 2025, operations here have been largely disrupted by an industrial action embarked upon by members of the Joint Health Sector Union, JOHESU. This is the emergency registration point of the National Orthopedic Hospital, Igbobi, and these seats are supposed to be occupied by patients waiting to be attended to by the doctor for treatment, consultation, and care. Right there is a spot where the record officer is supposed to be to provide e-card for the patient so that all of their records can be passed to the doctor. But because of this ongoing strike, this has been grounded. All activities have been brought to a halt right here at the National Orthopedic Hospital, Igbobi. Leaders of the union say the strike is the outcome of prolonged government inaction on their welfare, remuneration, and the implementation of agreements already reached.
The strike has been on for 67 days, and our major demands has been the resolution of the inequality in the health sector, but the major issues is about the adjustment of CONHES, and that's why we have been on strike. And yes, CONHES, Consolidated Health Salary Scale. There is a need for it to be adjusted because CONHES, that's the Consolidated Medical Salary Scale for doctors, have been adjusted twice or 3 times.
This man who brought his daughter to seek medical attention is very disappointed as he is unable to access the needed care due to the disruption in services resulting from the industrial action.
My daughter is not feeling fine, so when I came here, that they referred me to this place. When I came here, the way I see around, they say that there's no, everybody are vacated, there's no situation of to attend to me. I'm very disappointed, I'm very sad. I'm feeling pain that I am very disappointed. Please, the government should try to do something about it.
In a January 8 circular, the federal government ordered a no-work, no-pay policy for the striking JOHESU members, insisting essential services will continue despite the strike.
The issue at hand is our CONHES adjustment, which we have been on it for the past 12 years. Promises upon promises. We've signed a lot of memorandum, and none of it was approved. The circular of no work, no pay, we want to let them know that it's not going to move us. We are ready.
However, the national leadership of JOHESU has insisted that it embarked on the strike after exhausting other options, including dialogue, consultations, without concrete results.
It is quite unfortunate that we are not seeing the response we expected from government. Nobody expected that this strike would be up to this 2 months, over 2 months it's been now. But unfortunately, their response has been poor. It has been promises, it has been resumed, we'll get back to you people. And these are the old stories we have been hearing. So we expect that they should get to the negotiation table, let agreement be signed, and let us see that the agreements have been effected before we resume.
What we're asking for is not equality, we're asking for equity, and we're asking for parity. Of course, everybody has their entry level into the service. So we're asking that government should do the needful and adjust CONHES, just as the way they've adjusted CONHES in the past 12 years.
This is a 32-bed ward at the National Orthopedic Hospital, Igbobi. It is supposed to be a beehive of activities, with the beds occupied by patients, getting attended to by nurses, pharmacists, and other health workers. But because of the ongoing impasse between the federal government and JOHESU, which has now spanned for more than 2 months, patients are the silent recipients of the grounding of activities. At the Lagos University Teaching Hospital, Idiaraba, the effect of the strike is also visible, with empty roads and reduced activities around the premises. JOHESU says it remains open to dialogue, but warns that the strike will continue until outstanding demands are addressed in a fair and sustainable manner. For now, the hospital wards remain quiet, beds empty, and patients left waiting, caught in the middle of a dispute with no clear end in sight. Omobolanle Adeshui, Arise News, Lagos.